What about the risks of breast implants? Well, this section is really, really important because there are risks. It's not a perfect procedure, and you need to understand those risks before you decide to go ahead with breast implants. There's two types of risks. There's the general operative risks that would apply to any operation, whether you were having breast implants or whether you were having your appendix out. Anesthetic risks, for example. Poor scarring is another one. Then there's a second set of risks that apply just to this operation, to the breast augmentation operation. Leaking we've already spoken about. How common is it? Well, nobody knows for sure, and it's probably different for different types of implants. But as a general guide, perhaps 1 in 10 patients by 10 years has got a leak, something like that. Remember, it's not dangerous. Most people who have one don't have any symptoms, and they just find it because, coincidentally, when they have a scan for some other reason. The commonest complication by far of breast augmentation surgery is called capsular contracture. This is where the implant goes hard or goes out of shape. It happens because whenever you have an implant put in, your body will react by growing a membrane around it, a bit like a second skin to the implant. It's on the inside, you can't see it or feel it, and it surrounds that implant, walling it off from the tissue around it. Most of the time, that membrane will remain the same size as the implant, and the implant feels normal and soft within it. But in a certain percentage of people, it will behave like shrink wrap, compressing around the implant, squashing the implant, making it go out of shape, making it feel firmer, sometimes making it feel rock hard like a stone and even being painful. Nobody knows for sure what the cause of capsular contracture is. There's various theories, but we do know it happens quite commonly. And this goes back to the surface of the implant. You'll remember that there are 3 types of implants: smooth, textured, and polyurethane foam covered implants. With smooth and textured implants, we now know that this happens in at least 1 in 5 people by 10 years. 20% by 10 years, that's very common. With the polyurethane foam implant, it happens in about 1 or 2% by 10 years. That's a huge difference and a huge advantage of the polyurethane foam implant, and we're going to talk about that a bit more in a different section. It used to be thought that textured implants would reduce the risk of capsular contracture, but we now know from data that's been developed in the USA by the regulator over there, the FDA, that in fact there's no difference between smooth and textured implants. They have the same rate of capsular contracture by 10 years. The only surface that makes any difference is the polyurethane foam. Capsular contracture isn't dangerous, but it's a nuisance and people obviously don't like it. If you're unfortunate enough to get capsular contracture, the only treatment is surgical. You need to remove the implant, you need often to remove that membrane that's behaved like shrink wrap and replace the implant. And if you replace it with a polyurethane foam implant, it's less likely to happen again. Another relatively common complication of breast implant surgery is bottoming out. That's where the implant slips down below the crease where it was originally. As it slips down, the nipple stays in the same position, so it looks typically like the nipple is too high on the breast because the nipple stayed the same and the implant has bottomed out or dropped down. This is more common with smooth and textured implants because they don't grip. Again, it's less common with polyurethane foam for reasons that I'm going to explain in the polyurethane foam section. Similarly, rotation can be a problem. This is where the implant spins. Now, if it's a round implant, it doesn't matter because you won't be able to tell. But if it's a teardrop implant, it does matter because it can look very odd indeed if a teardrop implant rotates. Yet again, the polyurethane foam implants much less likely to rotate. What about the risk of infection? Well, happily this is a low risk. There's 2 types of infection. You could have a wound infection where the scar only is infected, and that could result in a worse scar if it happens. Much worse would be infection in the implant cavity. This would be bad because if it happens, really you're going to need to remove that implant and leave it out for a period of time, probably about 3 months before you can put it back in. Luckily, these infections are very rare, less than 1% of patients who have breast implant surgery. Bleeding can occur in the post-operative period. This is typically in the first day or so and presents with a rapid and painful swelling of the breast, almost always on one side. It's called a hematoma. It's a collection of blood inside the cavity around the implant. If this happens, you must call your surgeon straight away. You'll probably need to go back to theatre to have the blood clot removed and to stop the bleeding. Fortunately, this complication is uncommon, happening in less than 1% of patients. Sensory changes in sensation, will occur with breast implant surgery. Usually they're temporary, but they can rarely be permanent. Typically what happens is there's an increase in sensitivity of the nipples for a short while and a patch of numbness between the nipple and the crease underneath the breast. The nerves are the slowest tissue in the body to recover, so improvement in sensory changes goes on for up to 2 years after your surgery. Permanent loss of sensation of both nipples can happen, but it's extremely rare. A particular type of risk with breast implants is called double fold, or double bubble it's sometimes known as. This is where you can see 2 creases underneath the breast. The first crease is the original crease of your breast tissue. The second crease is formed by the lower edge of the implant. Certain types of breast are more prone to this, and we'll be able to advise you in the consultation if you're at risk of it. If you are at risk of it, there are certain steps we can take in your operative plan, choosing the right shape of implant, the right plane of implant, how we actually do the surgery to minimise the risk of double fold.